Welcome to Chapter 3, Working in Healthcare. The important learning outcomes for this chapter, we're going to define licensure, certification, registration, and scope of practice. We're going to define accreditation, and we're going to summarize the purpose and scope of authority for a state's medical practice acts and medical board requirements. We are also going to learn about the changes in business management of medical practice. We're going to distinguish between the different types of managed care organizations, which are healthcare organizations or health insurance organizations, and we're going to discuss the major federal legislation enacted with intention of improving the American health care. Here is a list of important key terms for this chapter and also some healthcare laws. This is a continuation of the important key terms for Chapter 3. Licensure. So it is a mandatory credentialing process that's established by the law at the state level. It's required in every state for physicians, nurses, and other healthcare practitioners, and licenses can be canceled or revoked or temporarily suspended under certain circumstances, which reciprocity is very important if you want to transfer your license to another state. So for instance, when I lived in Texas, I got my certified pharmacy technician license. And so when I moved to Indiana, I actually had to get an Indiana license. I did not receive reciprocity, which would mean that I would be able to work in Indiana with a Texas license. However, when I had my Indiana license for being a pharmacy tech, I was allowed to work in Kentucky because Kentucky offered reciprocity from Indiana. Scope of practice is very similar to role fidelity that we learned in Chapter 2. It just basically means that you're sticking to the duties and the competence, which is like the education that you learned for your license. So if you are a medical technician, you are not going to prescribe medications for a patient. That would be outside the scope of practice. Certification is a voluntary credentialing process, whereas licensure is a mandatory process. And sometimes there's an exam required. Sometimes it's taking a certain amount of classes in order to be certified in a certain subject. Registration is a different type of credentialing procedure where your name is on a list. And it just means that you met these educational requirements within your profession. So if someone were to Google you, they would be able to find that you had an active registration or an active license or certification. Accreditation. So it's an official authorization or approval of an organization to basically mean that it's meeting certain federal standards. So the Joint Health Commission is the one that accreditates all healthcare entities, and it just means that the healthcare educational organizations and their policies and their standards and their ethics all meet this federal level of criteria. The Joint Commission is a major accreditation agency for hospitals, long-term care facilities, clinical labs, ambulatory care, also with surgery, group practices as far as doctor's offices, rehab centers, labs. An educational program accreditation. So it just means that the school meets the federal standards. It also is helpful when you need to transfer your courses and it means that you have met the educational and clinical requirements while being at that educational institution. So we want to make sure that students are appropriately certified when it comes to laboratory. So that would be like your OSHA certification. We want to make sure your internships or externships are places where you're actually going to learn, that are safe, and that you're going to fulfill your competencies. And we want to make sure students are able to Medical practice acts are very, very, very important. That is a hint with a wink and a star. So keep medical practice acts in mind. So basically it tells you what it means to practice medicine in each state. So it's not like a federal law, but it varies per state a little bit. And it tells you the requirements and methods for obtaining your license in each state. It tells you what your job is, what to do if your license is suspended or revoked for any reason, or when you need to renew your license. Medical practices are changing. That's due to the economy, it's due to a lot of technology, it's due to the elderly population having a boom and retiring, and also that people are living longer. So now most physicians, they're not solo anymore as in before. You might have multiple positions in a group for a group practice, or they might work specifically with certain hospitals. So today and in the future, medical practices will be owned by corporations. So if you think of Kentucky One Health or Norton, it's not just Dr. So-and-so's office anymore. All right, so managed care organizations. So they deal with financing, administration, and delivery of health care to provide medical services to subscribers for a specific fee. So it could be if your job or your employer has subscribed to a certain health insurance company, and the health insurance company is going to provide medical services. So you have contracted fee schedules, and that is whatever the fee was contracted out for that certain business. Because in order for a business to link up with a health insurance company, they want to know beforehand how much they're going to have to pay, and how much their employees would have to pay, and if that would be sufficient. Also, we have a percentage of fees. So for some people, that's like 80-20, and that would be where the healthcare insurance takes care of 80% of it, while the person pays 20% out of pocket. Now that could change once they meet their deductible. It might drop to 60%, or it might increase to 100% that the health insurance would take care of. And the deductible is how much you have to pay out of pocket before your health insurance starts to take care of all of it or start to take care of some of it. And that could vary depending on the type of health insurance you have. So you could have your own health insurance that you buy off of the marketplace, which would be private insurance. And the marketplace is just an area online where you can look at various types of health insurances and compare and contrast and see which one works best for you. You can get health insurance through your employer and look at the choices that they offer. So they might offer one type of health insurance company, but they might offer a variety of plans, and that would just depend on what your needs are. So if you're somebody that is going to cost a lot because you have health issues or your child has health issues, then you would basically want to look through that health insurance plan and make sure your medications are covered, make sure the type of surgeries or procedures you're going to have are covered, more so than someone else who barely ever uses their insurance. They might just choose the cheapest option since they might go to the doctor once a year. And then capitation would be a set of an advance payment that's made to providers based on the calculated assumption of medical cost of everyone. So your business might say, well, we have 30 employees, the majority of them are healthy, so therefore this is how much it should cost in order for us to link up with this certain health insurance company. Types of managed care business. So we have health maintenance organizations, and that is going to start on page 59 of your book. And so we have health maintenance organizations, we have preferred provider organizations. So preferred provider would be where your health insurance says you have to go to a certain type of doctor in order for your medical care to be covered, and that would mean you're in network. And if you see somebody that's not part of that preferred provider, that would mean you're out of network. And then the HMOs can be very confusing. You have a group model and a staff model. So the staff model basically deals with salaried physicians and other people, and they have everything at one location. So it's more like a one-stop shop. Some companies have that even in their building where people can go downstairs and see their doctor, get their eyes checked, whatever they might need. If they're not feeling well, get their medications all there. And the other type of group model is where they might see a variety of the type of people. You might have a member fee that's fixed, so you pay a certain amount to see the doctor, and you can see more than you could on the staff model HMO. However, a lot of people have issues with the HMO because it's like the health insurance companies are controlling exactly who you see when you see them. They control what's going to be covered. They might say if you're a certain age, you might not be able to have access to a mammogram. However, you might have that issue in your family, or you might just start having pain in your breast, so you want to get it checked, but then it'll be out of pocket. So health maintenance organizations do have some issues. They all kind of do. So we have independent practice associations, and that would be where the doctor is like the sole provider there. And they might have staff that works under them. Dental offices are still like that, but a lot of doctors' offices are less likely to be like that now because of the cost. And then we have physician hospital organizations, since I already went over preferred provider organizations. So physician hospital organization basically includes physicians, hospitals, surgery centers, nursing homes, labs, and other medical services that contract with one HMO insurance plan or directly with employers. So basically, that would be like if you have a health insurance company that says that you deal with Norton providers. So a Norton health insurance plan, it doesn't mean you work for Norton. It just means that that is your health insurance. So you would go to just those facilities. If you went outside those facilities, you would pay more. Then we have exclusive provider organizations, which is also on page 60 of your book. And it pays for healthcare services only within the plan's network of physicians, specialists, and hospitals, except in emergencies. So you don't want to basically go out of network because you'll pay more, which, is the same for all of them. And then we have a variety of access plans. And that means that you're able to see different doctors for different things. Legislation affecting managed care. So as far as healthcare goes, we have the Healthcare Quality Improvement Act, and that is on page 62 of your book. And basically in 1986, Congress found that a lot of doctors are being sued and they need to improve the quality of care, and it could vary by states. So they created the National Practitioner Data Bank, and it's the use of the bank that's intended to improve the quality of medical care nationwide by encouraging effective professional peer review of physicians and dentists. So basically, we just want to make sure that doctors are treating patients well. They're not doing illegal things. We're trying to decrease the amount of malpractice that happens. As you've been reading in your textbook, you have a variety of court cases. There's way more than I assign. Feel free to read them. They are all true, and you could even Google them if you wanted to know more information about the cases, since it only includes a little snippet. We also have HIPAA, so the Health Insurance Portability and Accountability Act, and that is on the bottom of 62, and it goes on to 63. So basically, we want to make sure that health information isn't leaked, whether it is online transmission or it's through someone speaking. We want to make sure we're able to bill and process paperwork in a timely manner. We want to make sure patients are able to understand their paperwork. We want employees to be able to keep their health insurance when they transfer to another job. So that was a very important part of HIPAA. people didn't want to experience job lock anymore, where you would lose all of your insurance if you switched jobs. So now people are able to maybe keep it when they transfer to another job. So that way they're not unprotected. And we also want to make sure that people don't hack this information or breach this information. So moving on to the Patient Protection and Affordable Care Act, or we call it the Affordable Care Act or the ACA or Obamacare or the PPACA, but that became law in 2010, and we wanted to make sure that patients had affordable access to care. So we know the law was great in that it gave people access to health insurance, but it was not great in that some people, their health insurance did not go down, it went up. So this law did a variety of things. We're going to get more into it later. And also you're going to have a paper that is due on finals week. Not finals. It's due during your midterms. And basically what I'm going to ask you when it comes to the PPACA and a bunch of other laws is to state one thing you like about the law and one thing you dislike. So an example of this would be, for me personally, yours would vary. And as long as you tell me why you like or dislike this thing, that's the point. I want you to be well-informed citizens, so don't think that there is a right answer, as long as you have facts there. So for me, as far as the PPACA, if I were writing the paper, I would say I agreed with the PPACA because it gave people with pre-existing conditions access to health insurance. I was somebody that was basically denied health insurance prior because I was born with pancreas issues, or the insurance companies would increase my health insurance so much where I couldn't afford it. Before the PPACA, that was actually legal to do, or they would just drop you because you cost too much money for them. Health insurance, honestly, is more for healthy people. It is not for the sick. The point of the sick getting insurance is for the healthy people to carry them, which is why the PPACA did mandate for people to buy insurance, and if you didn't get it, you would be taxed. So that would be the negative for me. That what I disagree with the PPACA was the people that ended up getting taxed for their health insurance if they did not get health insurance. So some people didn't purchase health insurance because it was too expensive already. So they just couldn't take more out of their income. But what I didn't like is that they were charged when they went to do their taxes. Since everyone has to do their taxes, it was a perfect way of getting people, but I didn't like it. And it went up every year. However, with the current Trump administration, they did take that part away for the PPACA. So people now will not be charged if they don't have insurance. But the issue with that also is, how do we take care of the sick people, since if enough healthy people don't buy into health insurance, then they're going to charge more for medications or things like that. So it's just all confusing. We need a way to fix these healthcare laws, and that's basically what I want you to do with your paper. I'm going to have you look at laws in other states. So some states, as Hawaii does, they have it to where it's about 4% of their people don't have health insurance, and that's because people are able to get health insurance even through their part-time employers. So I want you guys to look at those. I want you to look at Medicaid and Medicare. I want you to know what those are. I want you to know what COBRA is. So the paper is going to be in 3 parts. It's, I believe, 13 paragraphs. It's really not hard. I just want you to be well-informed citizens. I will have more of an explanation for your paper. I'm going to have that open and posted so you all can get started to have it done before week 5 or within week 5, which is midterms week. And let me know if you have any questions on that.